When I heard that she had leukemia, all I could think was, I can't imagine my life without her.
In 2008, Caroline Greenwood was diagnosed with acute myeloid leukemia, a rare type of blood cancer. She was just 30 years old and a mother of a 10-month-old baby boy, Luke.
It just changed everybody's life. It changed her life, it changed her husband's life, a little baby. Everybody was just devastated.
Caroline started a course of chemotherapy, followed by a bone marrow transplant. She responded well and went into remission. But just a year after she was first diagnosed, she relapsed. After a second bone marrow transplant, Caroline developed a serious complication known as graft versus host disease, or GVHD, in which the donor cells attack the recipient's tissues.
Oh, GVHD, it's so varied. It can be skin rashes, it can be all kinds of things. In Caroline's case, her mouth, throat, stomach, bowels, all the way through, ulcerated, so that she couldn't eat. She lost so much weight, she was almost like a skeleton.
It took an immense amount of determination to get through that, an immense. Her resolve, her ability to battle, to survive, to be there with Luke and I was unquestionable.
In 2011, Caroline and her family were given devastating news.
When they say your blood counts aren't right, you know that it's bad news. And they said, we're really sorry, there's nothing else we can do. And it's palliative care. And Caroline said, I can't accept that.
This third transplant was probably 2 or 3 times more difficult than the second one. Eventually she went into ITU. She said to her mother on the way, on the bed on the way up, she said, "Mummy, I don't want to go." She goes, I don't want to die.
Blood cancers affect over 30,000 people in the UK every year. But there is a charity that's working to find better treatments for leukemia and other related conditions. Leuka is a specialist organisation that funds groundbreaking research into tomorrow's medicine for the benefit of patients today. The Catherine Lewis Centre at Hammersmith Hospital in London was built with funds raised by Leuka. The centre provides a range of facilities including an outpatient department, 14 isolated bedrooms for transplant patients, a stem cell laboratory and consulting rooms. Here patients can expect the very best care, and many have benefited from cutting-edge research funded by the charity.
Research isn't an abstract thing. For the patients that are seen here at the centre, it can mean the difference between life and death. Leuka's focus is on what's called translational research. So that's focusing on how you can get the results from the bench to the bedside as quickly as possible, so patients can benefit today from that latest research.
Many of the clinical experts who care for patients at the centre are also research scientists who are investigating new treatments.
Bone marrow transplantation is an extremely effective procedure to treat leukemia and several other non-malignant disorders. The procedure, however, needs to be perfected because it's often associated with 2 major problems. One is that the donor cells do not take in the patient, which means no blood formation and no ability to fight infections. Second, the graft versus host disease.
Through innovative research, part funded by Leuka, scientists have discovered the benefits of a new type of therapy using mesenchymal stem cells that can be used to successfully control a patient's unwanted immune responses.
We now believe that mesenchymal stem cells have the ability to control both side effects, foster blood formation and control graft-versus-host disease. We have already used these cells in 60 patients nationwide with the help of Leuka, and we have observed that 40% of these patients have responded completely to the clinical treatment.
Dominic Toos was diagnosed with a rare blood disorder when he was just 21 years old.
I just started getting small symptoms which I didn't realise made a bigger picture. So I'd have bruising that just appeared on my body, bleeding gums. I was really tired and I started picking up colds and bugs and that sort of thing.
After 4 years of treatment to control his condition, Dominic's health deteriorated and he needed to have a bone marrow transplant.
I was so convinced that the first transplant was going to work that when it didn't work, that was the biggest hit. For them then to say, oh, well, we're going to have to start from scratch again and go back to the beginning, it didn't really make sense.
But when a second and later a third transplant failed, Dominic began to lose hope.
You mentally have to really pick yourself up and get on with it and just realise that there are no other options. You've just got to keep going forward day by day.
It was during a fourth transplant that Dominic received the new stem cell treatment, which doctors believe ultimately saved his life.
Now I can look forward to continuing the rest of my life, getting back to work, living back in my flat, and I recently got engaged, so getting married is a big thing in the future. I just feel very lucky. I don't know why I'm lucky, but I am lucky to be able to have got through. Yeah, because not everybody does.
Thanks to studies over the last 30 years, a lot now is understood about leukemia and treatments are improving. But there is still work that needs to be done. Leuka is part of a global effort to find a cure for leukemia and other related disorders. With your help, a cure is within our reach.
Although Caroline and I were unsuccessful, that doesn't mean you should ever give up. The research can prevent other families going through what we went through.
There are so many breakthroughs in leukemia research, but unfortunately they've not been breakthroughs that benefited my daughter. But those breakthroughs will come as long as we, all of us, support leukemia research to enable the breakthroughs to come for everybody.
If you would like to make a donation, please text LEAD41 £5 to 770 or visit leuka.org.uk/donate. Thank you.